appendicectomy. You are watching the operation from the leg end. I am palpating anterior superior iliac spine and umbilicus to mark the McBurney's point at the junction of lateral 1/3 and medial 2/3 of the spino-umbilical line.
This is the other modified but also commonly used technique where you have your camera at the umbilicus, you have a right upper quadrant port and a left lower quadrant port. Now that our ports are placed, let's get into talking about the procedure. When we first get into the abdomen, the goal is to identify the appendix and do a brief survey of the abdomen. Next, we'll look for the base of the appendix because that's where our staple will go across. We want to dissect the mesoappendix and ligate the appendiceal artery, which is often done in the same step. Then we'll staple across the base of the appendix and remove it from the abdomen. Now, when starting the procedure, the first step is to identify the appendix. In this patient, she's actually pregnant, and as we've been saying, the appendix can be located further up in the right upper quadrant. What you were just seeing on the other side of the screen there was her uterus. Now, as they lift the appendix up here, you can see that they're grabbing it at the tip. This part here is the mesoappendix, and our base is here. Usually, once you identify the cecum, you can follow the tinea across. I'm Dr. Anjali Arora.
And I'm Dr. Craig Goodmurphy.
Thank you for joining us to learn about the laparoscopic appendectomy.
And we'll see you next time on the Anatomy Guy with more clinical subspecialties.